Can prolotherapy get rid of bursitis? That's a very, very good question. When I first came here and I was working with Dr. Hemon, obviously he was the guru, for probably from the mid-70s till like, say, the mid-90s. I mean, he really was the guru. So he said to me, Ross, every time the orthopedist diagnosed bursitis, it's wrong, almost every time. And he said, somebody who has a bursitis, a true bursitis, where the bursa, which is a fluid-filled sac, when that thing's inflamed, the pain on a scale of 0 to 10, it's like 100. So in other words, just you as a doctor going near it, they won't let you touch it. Even like the clothing on the bursa is like painful. So if you don't have pain to that degree, I'm telling you, you don't have bursitis. You don't have bursitis, okay? In the course of 18 years, I've had like 2 cases of true bursitis. And guess what I did? I did inject a little bit of steroid in there, boom, and it got rid of it. So, because that's a bad kind of inflammation. So most of the time when people have quote-unquote bursitis, it's not a true bursitis. Let me give you an example. Okay, so a very common one is there's a bone on here called the greater trochanter, and the greater trochanter is tender on the person and it's causing pain, okay? But it could be in the shoulder, anywhere where there's a bone. So whenever there's a bone and there's a muscle or a tendon over it, and the body, so there's not the rubbing, there's a fluid-filled sac. So true bursitis is where that bursa becomes all inflamed. If it truly does happen, the area is red, it's inflamed, it's hot, and the pain on a scale of 0 to 10 is like 100. So one time that happened to me with my Achilles, I had an Achilles bursitis, so I know exactly what it feels like. So in that particular situation, I did put ice, I did take anti-inflammatories, and in a day, really I was fine. But most tenderness on the bone is because of the tendon. The tendon is degenerated, or the tendon is weakened, or the tendon is torn, or the muscle origin on the bone is degenerated or it's torn. So the treatment in those situations is prolotherapy. Prolotherapy to a tear, to a degenerated area or a weakened area is going to strengthen it. So I am kind of answering the question, but not answering the question. But true bursitis is very, very rare. A good thing is if you touch the area and it really feels like the same temperature as the other side, I'm telling you, you don't have bursitis. So getting steroid shots and everything for a degenerated muscle origin or tendon is going to degenerate it more. So don't do it. Go to a prolotherapist, get some prolotherapy where it's hurting. It'll strengthen the area and then the pain will go away.